Hello and welcome. I am so excited that you are here taking action to not only support your health, but think outside of the box when it comes to weight loss, health, and food. I am Dr. Alison DiBarto Goggin, and today we are going to cover the top 3 weight loss myths about why you can't lose weight. So you might be here because you struggle with weight loss. You've tried every diet and nothing seems to work. You've tried all of the supplements, pills, powders, detoxes. Your weight keeps you feeling tired and sick and sad. You might have lost your confidence in your body, maybe even in yourself. And you're probably really confused. You're reading blogs, you're listening to the so-called experts. Maybe you even watch your friends lose weight and they keep telling you to come with them to the gym and you got to try this diet or you got to read this book and it's working for them. But most of the time, everything you read or hear seems to contradict everyone else. It seems to work for everyone else. Nothing's working for you. And you're just really confused. You don't know what to do and you're just lost. If we haven't met yet, I am Dr. Alison DiBarto Goggin. I am a functional medicine physician, and I have worked with thousands of women who struggle with chronic health issues, weight gain, and anxiety, and I've helped them reconnect to their body, their health, their life by figuring out what's going on within their body. This is not just about weight loss, it's about what is keeping your body sick and tired, and how can we address that with really easy, simple solutions. So tonight we're going to dive into those 3 myths, and I'm going to tell you one of my secrets before we dive in. I hired a few years ago a good friend who's an amazing health coach to help me lose weight. I complained bitterly about how nothing was working and I've tried everything, and she helped me create a meal plan for the month and gave me the accountability that I seriously needed. About a month into our program, I hadn't lost any weight and I was feeling the same. Well, actually, I was feeling worse. What I hadn't told her was that I was struggling with ulcerative colitis and that most foods gave me severe gut inflammation, bleeding, pain, I was curling up into a ball. I thought I was eating healthy. I mean, I know I was eating healthy. How does salad make someone really sick? It's healthy. We need these type of food. But what was healthy for some people was devastating to my body. So what we're going to talk about tonight will be some health basics, but also diving deeper into what's going on with your body and health. So my myth number 1 is calories in versus calories out does not mean anything. Eating less will not help you lose weight necessarily. So I'll tell you in my practice, what I see most of the time is that most women aren't eating enough calories, fat, and protein. There's such a pervasive message to eat less, eat less, eat less. And so many women come to me when they're eating 800 calories a day, 500 calories a day. They're starving themselves. They're doing intermittent fasting. They are not eating at all. And yes, there's a lot of people who eat way too much. I work with people who come to me and they're eating 3,000 or sometimes even 4,000 calories a day. There's such a wide divide on eating less that we actually get into a very difficult mindset about food. And this becomes a punishment for your weight or how you feel. And a lot of women will just jump on the scale every morning and say, oh no, I weigh more today, so I have to eat less. I'm not going to eat. And it becomes such a punishment and such a debilitating way to live your life. Calorie restriction is not long-term sustainable. So of course you're going to fall off. You're going to binge. You're going to lose your progress. It's going to become very difficult. And the other myth I see with this is that if it fits in my macros, I can eat it. My trainer said that I need to eat 30% fat, 30% protein, 30% carbs, and I'll be just fine. And we know that's not true. And a lot of people have come to me and said, yeah, I didn't eat all day, but I'm having pizza and fruit snacks for dinner. It fits in my macros. Look, I track it. And my trainer said I can have pizza. And the reality is that that's fine if it fits in your macros, but your body needs nutrition. We're eating to fuel our body and our cells for energy and life and hormones and motivation and just enjoying our life. We're not here to punish ourselves. And we're also not here to punish our body for being the way it is. And we need to accept that food is fuel. So the truth is that our body does not use processed foods the same as it does as fruit and vegetables and meat. Fast food and restaurant foods are processed and cooked differently. So while you might be having a salad at your favorite place, it's still covered in different oils and preservatives and other chemicals that could be affecting your health. Starving yourself or using a calorie deficit may actually harm your body and increase your weight if you have a hormone dysfunction or thyroid issues. Now, this is where I teach my people and my patients about their blood sugar type, how to recognize their blood sugar type, and how to eat to that type. Where some people do really, really well with fasting, whether it's intermittent fasting, 1 day a week fasting, long-term fast, that's fantastic. It's not for everybody. Whereas some people with some blood sugar types will be miserable if they fast. It will exacerbate their symptoms. So we have to figure out exactly which one you are. And we also have to look at your hormone function and your thyroid and all of these other issues. And you can work out all day long, right? So this calories in versus calories out theory, but you're never going to see the scale move because you still need a combination of support, not just eating less and moving more. Our bodies are so much more complicated and precise than it is that we've been told to eat less will help you lose weight. Myth number 2 is actually my favorite one because a lot of people think that being overweight is about willpower, not biology. And we blame people and we shame them and we say, oh, if you could just work out, oh, if you could just control yourself. And you might even say that to yourself, like, oh, if I could work out 2 hours, or if I could just eat a specific way, then my body would change. And weight is so multifactorial. It's not just about willpower. Just like me, when I struggled with losing weight, I was focused on the wrong thing. I should have been focused on healing my gut, my malnutrition, getting my inflammation and my pain down. But instead, I was so focused about the number on the scale and the number on my jeans and my dress size that I forgot the main factors of healing. And it's so pervasive again in our society that we have to look a certain way and be a certain size, and a certain weight means that we're good and we're healthy. And that's just not true. Being overweight, whether it's in your mind 5 pounds, 100 pounds, 200 pounds, has some to do with willpower, but more to do with biology. So I'm going to run down my list. We have thyroid disorders, whether you're hypothyroid, hyperthyroid, or even you have autoimmune conditions, you're going to struggle losing weight. There's no amount of willpower and exercise and diet that's going to fix this until you get your thyroid under control. Blood sugar imbalance, like I talked about before, we have reactive hypoglycemia, prediabetes, diabetes type 1, 2, 2.5, and 3. There's also autoimmune type diabetes that develops later in life. What about sleep disruption? If you're not sleeping because you have insomnia or panic attacks or severe fatigue and stress, you're not going to lose weight, and eating less is not going to fix your insomnia, and it's also not going to fix your weight. Anxiety and depression medications are strongly linked to weight gain and have a difficult time releasing weight when you're taking these types of medications. That doesn't make you a bad person. It doesn't mean you should stop taking them. It does mean that you have to approach your weight loss from a different lens. Histamine reactions and allergies also affect your weight. Taking antihistamines can cause weight gain, as well as having mast cell disorders. Any type of histamine disorder can cause difficulty losing weight or maintaining a healthy weight. Gut health, like myself, if you have IBS, colitis, Crohn's, celiac, any type of autoimmune conditions, you're probably going to struggle losing weight, and you need to focus on healing those. Inflammation can override any system at any time. What about hormone imbalance? If you have PMS, PCOS, which is polycystic ovarian syndrome, estrogen dominance, struggle with infertility or low progesterone, or have a testosterone imbalance, you're going to have difficulty losing weight. And this is why testing is so important. This is why functional medicine is so important, because when was the last time your doctor asked you about your diet, your meal planning, your goals, your whole health issues, and actually believed you too? When was the last time a doctor made a whole lifestyle plan for you? When was the last time a doctor said, oh, I see all of these issues. Of course you have a hard time losing weight. Here's the plan to manage all of these things. Don't worry about your weight right now. Let's heal your body, okay? The truth is that weight loss does take time. It does take a lot of work. You can't go to the gym one time and lose 50 pounds. You have to go consistently. So while you're managing all of these whole body issues and discovering what's going on with your thyroid and your hormones and your anxiety and your gut and your brain and your inflammation, we can still eat specific to your body type and your body's needs, work out to your body type and your body's needs, and focus on healing your body as a whole, not just beating yourself up because you didn't get to the gym or you're not doing quote unquote the right thing when you don't even know what the right thing is because you don't know what's going on with your body. All right, myth number 3. This was a hard one for me to come up with because I had about 15 myths written down, and there's so much to talk about that I am so passionate about helping people understand their weight loss is so much bigger than just food. But really, this is really important because weight loss, pills, patches, drinks, smoothies, they don't necessarily work. There's the truth right away. You know this, I know this. There is no magic pill. I have tried, what was it called? 1DB Overdrive a long time ago. Went up to the nutrition store, grabbed it because I thought, ooh, this will help. And what's the first thing that the employee at the nutrition store did for me? They were very kind, actually pretty knowledgeable, and they set up a meal plan for me. And they said if I don't eat, and I don't eat enough food because I wasn't eating enough, I was not going to lose the weight with the pills. So it really is about food, whole body nutrition. There is no such thing as taking a pill or a patch or a drink that's going to help you lose weight. We look for quick fixes that destroy our hormones. It destroys our metabolism and our blood sugar and our gut. And we want to lose weight, so we do things that trash our adrenals within our cortisol levels. And then over time, you might lose weight quickly, but then it's going to creep on back. So do not fall for the scams. There's no weight loss pill, patch, drink, tea, nothing that's going to do that for you. We have to get to the root cause of why your body is holding on to the inflammation, to the weight, to the water, to the fat, all of it. Okay. So this feels like a lot of information to cover in a quick time and about 1% of what I would like to say about weight loss myths. So you probably feel a little overwhelmed. You might not know where to start, and doing another round of weight loss work on your own probably makes you feel defeated right away. I know it did for me. And there's so much to consider with your health when it comes to weight loss, not just calories, macros, and fitness. I don't want you to waste any more time, money, effort, or emotional turmoil. So I have set aside extra time over the next 2 weeks to speak with you personally about your goals, your needs, your health, and I would love to offer you a free health assessment. I believe that everyone is different and requires individual and personalized health plans. I want to dig in deep with you in ways that affect your whole life, emotionally, physically, and mentally, so we can take action together. So the link below this video has a messenger chat with me, so you can click on that. Let me know that you're interested in the weight loss bootcamp. And first and most of all, recognizing that weight loss is more than just about calories. It's about discovering exactly what your body needs to thrive, your specific metabolism and patterns, how to feel confident and happy in your body now, creating transformation and accountability for life. And while you may tell yourself that weight loss should be easier, and you're right, or that something else is going on that needs to be addressed, you're right there too. We want to take action together on that now. So what I'm offering is a weight loss boot camp through functional medicine, and you get a kickoff call with me to get a personalized plan, a private support group, weekly recipes, meal plans, nutrition support, weekly fitness routines, and online group workouts. So that's optional, but you can follow along at any time. They'll all be recorded. Weekly inspirational and wellness wisdom calls to empower you with information, education on health topics, mindset, nutrition, fitness, and so much more, and help you focus on your inner game of body love and confidence so you can release guilt around food and stop that punishment cycle so you can just really enjoy your health and feel good without harming your metabolism or doing anything that's going to affect your life long term in a bad way. So This is our functional weight loss boot camp. You can apply it below. I am so excited for you to be here and take these steps and really discover what's going on with your body. So thank you for being here. I look forward to chatting with you at your free health assessment. So make sure you apply below, and we'll see you soon.